Hi, everyone. Welcome to Brain Talks. I'm Deborah Kan, founder of Being Patient. Well, we've all heard the expression, what's good for the heart is good for the brain. And there's a lot more research going into how the two systems are connected, in particular, how our vascular system relates to our brain health. Well, a recent study found that women with high blood pressure during pregnancy, or what's a condition called preeclampsia, were more susceptible to dementia later in life. Joining me now is the researcher on this study, Heather Boyd, who's joining us now from Copenhagen. Hi, Heather, and welcome. Thanks so much for joining us.
Thank you for being here.
So let's just start with why you actually even thought of pregnancy. Because when I'm a mom of 3 kids. When I was pregnant, I certainly wasn't linking that to a higher risk of dementia. You're certainly not thinking of dementia at that time. So what made you focus on pregnancy in relation to brain health and risk of dementia?
Well, I actually came at it from the reverse perspective, because my research group spends a lot of time looking at pregnancy and looking at the cardiovascular consequences of pregnancy. So we know a lot about cardiovascular disease after pregnancy, cardiovascular disease after miscarriage, cardiovascular disease after preeclampsia, cardiovascular disease after preterm delivery. And it was actually my statistician that said, okay, if cardiovascular disease comes after all these things, what about dementia? Dementia is also a vascular, or can be a vascular condition. So that's actually when we sort of veered off into dementia. We didn't come at it from a dementia point of view to start with.
So how did you conduct this study? I know it involved over 1 million people, but there's a lot of years between pregnancy and dementia. So how exactly did you look at the study?
Well, in Denmark, we have resources, some unique resources that you don't have in Canada or in the US. And that's that they have these fantastic population-based registers. So every time somebody gives birth to a baby or is admitted to hospital or even sees a doctor in an outpatient clinic, that gets registered and it's put into these giant databases that researchers can use. So we didn't actually have to go out and recruit 1 million women. We just looked at what was in the register from as far back as 1978, which allowed us, because as you're right, there's a lot of time that goes by between pregnancy and dementia. So we exploited this unique resource to be able to answer that question. That's really difficult to understand, to answer at other places.
So what exactly did the study find? I mean, obviously, preeclampsia is a very serious condition. When you're pregnant, it can be fatal in some cases. But what was the relationship between preeclampsia and dementia?
Well, when we looked at dementia overall, so any kind of dementia, we saw that there was maybe a 50% increased risk associated with preeclampsia. And it wasn't until we started breaking it down by people had that you started to see the big effects. And so the biggest and most interesting and most astonishing finding for us is that women who had preeclampsia had vascular dementia later in life. We didn't see nearly the same thing for Alzheimer's disease, for example. There it was only about a 40% increase in risk. So it was really this very specific association between preeclampsia and vascular dementia that we found.
So what are you surprised by this, and what is the relationship exactly?
Well, it's a tough one because we're still trying to unravel preeclampsia, but most people will agree that preeclampsia involves some kind of vascular problem. There's a problem in the vasculature, whether it's the cells on the inside of the vessels. Nobody's quite sure, but so from that point of view, it makes sense that if you had problems with your vessels during pregnancy, you're probably likely either to still have problems later, or maybe that pregnancy sets you up for problems later. No one can quite agree whether it's because there's some underlying problem that gives you both preeclampsia and these later, your heart problems, your dementia, or whether it was something that it's a knock-on effect of what happened during your pregnancy. But it all seems to come down to your vascular health.
How much exactly do we know our vascular systems are related to our brain? Like what do we know, and what more do we need to understand?
I think we know very little, and we need to know a lot more. Yeah, no, here you've got me on the back foot here, because I don't actually know much about that side of it, about dementia. I know more about how it works, like I said, in pregnancy. So yeah, pass.
Were you surprised by the I mean, is it I mean, we know like diabetics are more likely, they're at a higher risk for dementia. There's a lot of comorbidities, heart disease, that factor into later on people having brain disease as well. So, how do the two systems really interact with each other to predispose us at a higher risk for a degenerative brain disease like Alzheimer's?
That's a really good question, and we really need to know more before we can answer that question. Because that's the question I've been getting now is, okay, how do we prevent it? How can we prevent, in women who've had preeclampsia, how do we prevent them from developing dementia? And we're really not sure. Before we can design any kind of intervention, we need to know how those two things are linked together. I know a lot of the comments to our studies have said, well, sure, I mean, preeclampsia, it causes, you can have maybe small bleeds in the brain, it affects the brain vasculature, so it makes sense that would later predispose people to developing vascular disease. And people have been asking, okay, what can we do to prevent dementia now among these women?
And is there an answer?
Yeah, at this point, I can't say go out and do all these things. I also think that if you say, okay, let's try and get the modifiable risk factors for dementia and for cardiovascular disease, if we try and reduce those, get your blood pressure down, make sure you don't develop diabetes, all the things you already know about. If we reduce some of those things, hopefully, but no, I can't provide any solution at the moment.
So where does the research need to go next? I mean, if we know that you're more at risk if you've had high blood pressure or preeclampsia during pregnancy, what's the next step to the research?
I think my next step would be, okay, preeclampsia is actually a fairly common condition. And no matter what our study showed, not all together. So where the research needs to go next is figuring out who actually does develop dementia. We need to be able to screen for and find those women, and then we need to figure out how, if we can prevent the dementia in those women. Because right now, if you suggested that everybody with previous preeclampsia be seen by a neurologist, you'd swamp the whole medical system.
Yeah, it's interesting. It's yet another piece of the puzzle. But the more research like yours does come out, the more it's just filling in links between different systems, really, and how they're interrelated.
Mm-hmm. Well, and the interesting thing about this too is we know that women are more likely to get dementia, right?
Absolutely.
So what is it that women do that men don't do? We get pregnant.
Yes.
So if you consider pregnancy as a sort of stress test for how your vascular system is going to respond over the rest of your life, you could conceivably use how you did while you were pregnant as a sort of screening tool for how you're going to do the rest of your life.
Absolutely, and how the interplay with hormones. I know there's a lot of research around hormones, and how they could possibly a fluctuation in hormone levels could predispose us to brain deterioration, unlike men. I mean, I know a lot more research has to go into that, but it's interesting to hear just these little pieces of evidence that are painting a bigger picture. And obviously, as you said, there's a lot more to learn on this topic.
Yeah, there definitely is.
All right. Well, thank you so much, Heather Boyd. Thank you for joining us from Copenhagen. We wish you all the luck with your research. Please keep us updated on where it's heading. And as I said before, it's yet another useful piece of the puzzle. So we thank you for that.
Well, thank you for having me.